On 31st March 2021, the Parliament of Uganda passed the National Health Insurance Bill that outlines the general structure for a first ever national social health insurance scheme in Uganda. However, the President declined to assent to it because there were still gaps to be addressed. In Luwero, Nakaseke and Nakasongola districts, the community health insurance scheme, locally known as Munno Bulwadde, was introduced by Save for Health Uganda in the year 2000. Frederick Makaire, the Executive Director, Save for Health Uganda, says over 12,000 people in Luwero District have enrolled on the scheme. Each member pays between 15,000 and 50,000 as premium and gets an insurance cover between 300,000 and 500,000 Uganda shillings.
We use the members' own capacity to pay. Are the people who are going to be in the scheme able, or how much are they able and willing to pay? So we involve them in terms of determining their willingness to pay, but we also try to find their own capacity to pay.
Members of Parliament on the Health Committee spent the whole of yesterday in Luwero District to learn and copy how the community health insurance scheme in this area works. The MPs were excited about the scheme, highlighting the significance of enrolling it on the national level.
Because they have testified, they no longer, mortgage their land, sell their cows, their goats, hens, and everything to cater for medical services.
Sickness just comes without knocking doors. So when you have the health insurance scheme, when you're not feeling well, you'll definitely go to the hospital. Some people hold on with the sicknesses, thinking that I'm still going to look for money, I'm still going to get money, and before you know, that sickness escalates and sometimes it's fatal.
There is no way we can reach middle income stage without the introduction of national health insurance. All countries that have moved from that level to another level, they have national health insurance to cater for their citizens.
In 2018, Luwero District Council passed the Community Health Insurance Ordinance to provide a legal backing to the scheme and require everyone in the district to have a form of health insurance. But the Solicitor General Francis Atoke declined to approve the ordinance, commenting that the Ministry of Health had introduced a similar bill, the National Health Insurance Bill, that was passed by Parliament last year. Now that the President declined to assent to it until the gaps are filled, leaders in Luweero want the Solicitor General to reconsider his decision and approve their ordinance.
We feel that now we can continue with it.
And then the district starts implementing a district-wide community insurance scheme, which will be for everybody resident in Luweero, and which will benefit people because they will be contributing small money and then benefiting from accessing many services.
Uganda is the only East African country without a national health insurance scheme and has the highest out-of-pocket costs for health in the region. An estimated 38% of Uganda's health expenditures are paid by individuals through out-of-pocket costs. Uganda's current health insurance options are employer or community-based schemes and are estimated to cover less than 2% of the population. Herbert Kamoga, NTV.